3,934. Unfortunately, over 3,500 have been confirmed deaths. This brings us to the case fatality of 1.6%. The Western Cape continues to have the highest number of confirmed cases at 72,156, followed by Gauteng at 71,488, Eastern Cape at 40,401, and KwaZulu-Natal at 16,743 confirmed cases. We however expect that Gauteng will be the highest number of confirmed cases when we next make the announcement, making it the epicenter in the country. We have used a differentiated approach in our response through a classification of districts as areas of low transmission or vigilance and high transmission, or what we call hotspots. In all the areas, the focus continues to go on the prevention of new infections, containment, mitigation, and recovery. The overarching objective is to strengthen the national and provincial mechanism for detection, management, and containment of the spread of COVID-19 with 9 overarching strategic priorities or pillars, which are the following. One is providing effective governance and leadership. 2 is strengthening surveillance and strategic information. 3 is augmenting health systems readiness by assessing health systems readiness against the epidemiological curve, identifying the gaps and planning to ensure services availability according to the need, focusing on the workforce, health workforce, beds, medicines, equipment, and products. 4, enhancing community engagement by ensuring effective communication to the public and improving laboratory capacity to test by strengthening the national health laboratory services, as well as the private laboratory capacity for testing COVID-19 to meet the requirements of the response and improve the coordination between the public and private sectors. And clarifying care pathways in respect of case detection, management, and clinical pathways, and to align the hierarchy of facilities established or reconfigured for COVID-19 response. And scaling up infection prevention control measures and strengthening capacity at ports of entry by enhancing screening capacity at the key entry points, and expediting research and introduction of therapeutics, diagnostics, and vaccine by institutionalizing mechanisms for COVID-19 related health products, regulation and research coordination, and building mechanisms for ongoing learning from research and experience from other countries. Between level 4 and level 3, which is June 1st, the number of COVID cases increased across the provinces. During level 4 of the lockdown, the Western Cape, Gauteng, Eastern Cape, and KwaZulu-Natal had the hotspots using the number 5 per 100,000 population of positive cases. This was our case definition, but of course, later on at level 3, these 2 additional provinces, namely the Northwest and Free State, also registered hotspots. Due to these increasing numbers, this definition will be improved and is going to be changed to take into account increasing transmission, as well as the readiness of our hospitals, our beds, our human resources, and other products. With regards to quarantine, as of the 7th of July, we activated 139 quarantine facilities across the country, which constitute a total of 12,532 beds. Community screening and testing program initiated on the 7th of April has ensured that more than 20 million people have been screened and 302,000 suspected cases were referred for testing. Screening in identified hotspot areas and emerging hotspots show that this program of screening has assisted in active case finding amongst high transmission communities, which has allowed our provinces to divert resources to the district or sub-district level. As on the 30th of June, 4,821 health workers were reported to have been infected with COVID-19 virus across the country. This data represent cases of health workers in both public and private sector, with the Western Cape continuing to account for the majority, which is 68% of healthcare workers, with 3,285 infections as on the 29th of June 2020. The leading number of infections are amongst the nurses, with 2,474 infections, followed by other health professionals, including community health workers, reporting 1,971, and doctors recording 377 infections. At this point, I do wish to pause to pay tribute to all our gallant heroes, those health workers who are out there saving lives and braving it all to face the difficulties of risking their own lives being infected, but they have gone all out to save the lives of South Africans. I'd like to say that those are our heroes. We salute you as health workers, and we really appreciate your dedication and commitment to the calling of caring for the nation. Several interventions have been put in place to address the infections among healthcare workers. Guidelines to support all healthcare workers across the continuum of healthcare of care were developed. A targeted training program was designed and implemented to enhance their understanding of the pandemic and facilitate application of these guidelines, which are primarily including infection prevention control, as well as case management. In-service training of all healthcare workers to ensure that workers can cope with the management of the pandemic relative to the scope of work has also been initiated. Occupational health and safety workers and visitors and clients is an important aspect of our response to COVID-19 as we unlock the economy. Department of Health worked closely with Department of Employment and Labour, and through NEDLEC, drafting a consensus document on workplace intervention in responding to COVID-19 and to ensure that the health and safety of workers. We also provided guidelines covering risk assessment in workplaces, symptom screening and testing of workers, psychological support interventions, disinfection of workplaces, and return to work assessment. PPEs, personal protective equipment, is specifically required to protect healthcare workers and other frontline workers from COVID-19 infection. Since the pandemic started, PPE supply chains have become severely constrained both globally as well as inside the country. Limited imports and shortages of raw material adversely affected the local production. Through the generosity of donations made by South Africans, the Solidarity Fund was able to commit a total of 815 million towards procurement of urgently needed PPEs for the country. The country also received generous donations of PPEs from several countries, foundations, businesses, and churches. We are happy that Solidarity Fund has indicated willingness to support immediate distribution of PPE in its position to various provinces. This will greatly assist us in closing the gaps in various provinces where there are stockouts on some of the PPE items. The rational use of PPEs is the greatest challenge facing us during this pandemic. Healthcare workers, labor unions, professional associations, due to the concern for safety for themselves and their members, are expecting to be provided with full PPEs or full spectrum of PPEs. In determining the PPE requirement for the healthcare workers, we're guided by the advice from the infection prevention and control experts. We want to assure frontline healthcare workers the PPE requirements for health workers will, at different levels of risk, will be informed by this evidence. Our assessment as of 7th of July is that we have sufficient PPE stock available to meet the requirements of frontline healthcare workers. We endeavor to ensure the appropriate PPE is made to protect the frontline care workers from getting infected by coronavirus. We have to work very closely with the unions and our management to make sure that the distribution is appropriate so that no one feels they are left unprotected. Our NICD and our Department of Health have provided a clear guidance for local clinicians and have updated that advice as evidence has emerged. In selected hospitalized patients, a short course of the drug dexamethasone can reduce deaths from COVID-19. The injectable form of this medicine is available in the country and will immediately be used in selected patients. And another drug that's also been used for COVID-19 patients is called remdesivir, which is used in clinical trials. I must say that the positive news of this nature has really given a lot of encouragement to our clinicians, because at least now there's evidence that there's some benefit on the use of these drugs. As much as we look forward to an effective and safe vaccine and to do more effective therapies for COVID-19, current clinical management relies mainly on supportive measures, including provision of oxygen. South Africa has a well-developed medical oxygen supply system, but careful planning and management will be needed to ensure that every patient who needs oxygen is able to access it. Since the last release of scientific model results on May 2020, the national COVID AP model has been updated to model COVID-19 at a district level, making use of South African hospitalization data, updated estimates of the reproductive number, and a shift in testing priorities. Current model projections indicate that while the epidemic is predicted to peak nationally at a similar time to the previously projected optimistic curve, that is mid-August, June, that is July to mid-August, it will do so, however, at a lower level. This means that fewer people were infected in May and June than was previously initially predicted, even under the optimistic scenario. While the model projects a lower need for hospital, non-ICU and ICU beds at national level, bed capacity is still expected to be breached or overwhelmed in all the provinces. Currently, planned hospital beds in the Eastern Cape and Gauteng are projected to be insufficient for combined non-ICU bed demand and the overflow of ICU once ICU capacity has been breached. Bed capacity, including all currently committed public and private sector beds, is expected to be breached in the next 4 weeks. The Department of Health has developed and is implementing the surge strategy in an anticipation of the peak. This will ensure that the department increases capacity for COVID-19, while at the same time continuing to deliver our other health services to the healthcare users. During this process, the department repurposed a total of 27,467 beds for COVID-19, which has increased to 40,309 beds as the provinces started to experience a certain increase in the number of cases. It is important to keep this balance here because we have also got indications of concern that the numbers of people who are coming for treatment for HIV, TB, and other diseases has been going down, and therefore we need to make sure we balance it up so that we do not have a problem of increasing fatalities due to the comorbidities. The Department of Health is working with the Department of Trade and Industry and Competition to manufacture continuous positive air pressure devices, which are called CPAP for short. Through this arrangement, the Department of Trade and Industry has mandated the South African Radio Astronomy Observatory to manage the national effort required for the local design, development, production, and procurement of the respiratory ventilators to support the government's response. These are being procured on top of the 1,000 ventilators generously donated by the US government. The Department of Health has built several field hospitals, which will primarily be used for admission of mild cases. The Western Cape has completed construction in 3 field hospitals, which are functional in Gauteng, in Nasrec, KwaZulu-Natal, in Pietermaritzburg, and eThekwini. The Eastern Cape in Port Elizabeth. Each one of these field hospitals are also now operational. The department is working with National Treasury and partners to conduct an audit of the oxygen reticulation infrastructure in all the hospitals. These audits are being conducted with priority focus on the Eastern Cape, KwaZulu-Natal, and Gauteng. The outcome of the audits will give us a sense of the amount of work needed to be done to address the gaps and undermine the expanded supply of oxygen to patients. We are already in touch with the manufacturers to be able to switch the use of oxygen from industrial use to increase for health for the health services. Honorable Chairperson and honorable members, before COVID-19 landed on our shores, we looked at the rising numbers in various countries with wonder. But now, it's no longer a matter of announcing numbers of confirmed cases. We're now at a point where it is our fathers, our mothers, our brothers and sisters and close friends and comrades that are infected. We feel the sadness of for every departed soul, and we share the anguish of the grieving families and friends. COVID-19 now has a face, a name, a family, and a house address. Now, very few South Africans have not been directly touched by the effect of COVID-19. As a country and the world at large, we are now in this reality where we must live with knowing that some of us cannot even bury our loved ones because of restrictions and even because we ourselves have been exposed. The pandemic that is attacking us globally will cause some of us lifetime scars. It steals from us, from some lives, from others' jobs, others' businesses. It is affecting literally every part of our lives. It spares no race, no gender, or social class. So, Honorable Chairperson and Honorable Members, we have now reached the stage. The storm that we have consistently warned South Africans about is now arriving. As a nation, we have every reason to be united in this fight against COVID-19. We dare not be divided. As a government, we have said we cannot fight COVID-19 enemy alone. We need all political parties, social partners, and every citizen to come on board. As we continue this battle, we look beyond our differences and ensure that whatever we and those around us change our behavior and observe all the measures announced to contain the spread of the virus. We must do so with a conviction that we have a duty to not only protect ourselves, but those around us. In the end, united, we will overcome. Thank you very much.
Thank you very much, Minister of Health.
Please mute your mics.
Switch off your.
Those that are at home, please mute your mics. After this, I feel I must remind all of us in the house that we need to put on our masks fully. Unless you are speaking, you can remove it. It's a plea that I'm making. Please. Mekharube, you are next.
Honorable Marube, you are next.
Mokaneng, please mute your. Thank you.
Chairperson, it would be amiss of me to not extend heartfelt condolences to the family and the friends of those who have lost loved ones during this pandemic. In the past 4 months, the country has experienced one of the most destructive and deadliest pandemics in recent history. As we gather here today, there are people who are languishing in hospitals, fighting for their lives in their homes, and over 3,500 people have lost their lives. To many, these are not just fatalities. It is a family member, it is a friend or a colleague. All the while, healthcare workers are throwing their bodies on the line, working in the most impossible conditions. Siyababulela ngomsebenzi wabo. Izinqe zabo ziyavakala. However, in our strategy of fighting this virus, we cannot simply be hoping for the best. Government strategy has to be grounded in concrete plans which will force the curve of infections down. This begins with proper resourcing of the health response in order for us to ensure that provinces are ready to handle the rising numbers of infections, so that those who require medical help are afforded a bed and that is fully kitted and staffed with the requisite equipment. This is not being fully done. The Minister of Finance tabled the adjusted budget 2 weeks ago, which painted a grim picture. The announcement that was made by the President several weeks ago of the 20 billion rand allocation turned out to be a reprioritization of existing provincial budgets. Simply put, provinces are now forced to find money to fund their additional needs using existing conditional grants meant for other services. The President has repeatedly stated that money should not be an obstacle and that government will make available financial resources that would build field hospitals, that will appoint additional healthcare workers, that will fill critical vacancies and provide life-saving PPE for healthcare workers. This is not being done. Additionally, resources can only assist where there are strong systems in place. Without competent administrative and political leadership, these resources will be squandered. This pandemic found the country's health system already on its knees. It is now dissipating even the parts of our system which were salvageable. The Department of Health should have taken the lead on stress testing provincial systems, augmenting them and ensuring that our preventive strategies were sound. Make no error, the explosion of cases isn't just because of an inevitable health crisis. It is also because our prevention strategies were found wanting. When we gathered here to debate the state of readiness for the coronavirus pandemic on the 5th of March, I pledged our conditional support to government efforts to fight this virus. We vowed to stand by you as long as you place the well-being of South Africans first. That was the condition. It was never a blank check. It was always about the people that we serve. You have let them down and we have withdrawn our support. The social contract that South Africa signed with its government was clear.
Honorable members,
Thuleleni umuntu ebheda uyabheda lo muntu they're supporting us, they're not supporting. The minister has just spoken well and ukhuluma umbhedo.
On a point of order.
order, honorable members said on the virtual platform, please. Order.
Chairperson,
Yes,
on a point of
Honorable
order.
Faber.
Chairperson, this is not the first time that Honorable Zulu has been interrupting. It's been going on for a few times on virtual meetings, and I would like you to please mute her.
Thank you. Honorable members on virtual platform and in the House, I'm not saying this for the first time, and I really want to plead with you. We shall observe the rules of the sittings of the National Assembly. Because the rule says you cannot just speak without being recognized. So if you switch on your mic, you are definitely doing something which is not allowed by the rules of this House. And it's unfortunate that you are not here, and if you mute you, we will mute people who are supposed to speak. Please, please bear with us. This is a very important topic that we are discussing now. We don't need the interruptions. Thank you, Mekharube. Continue.
The social contract that the South African public signed with its government was clear. They stayed at home at the expense of their lives and livelihoods, and government would build health system capacity. That contract has been breached. Government has failed to build healthcare capacity and uphold its end of the bargain. Minister Mkhize, the analogy that you make about the storm that is coming suggests that we are merely subjecting ourselves to destruction as we are seeing across the country, as though we are lambs to the slaughter. That is simply not good enough. If we have a fighting chance to save lives, then urgent steps must be taken to arrest the freefall. These steps need not wait for more lives to be lost. They require the political will and strong systems to be placed in place. They can be done today. Number one, you can begin by placing the Eastern Cape under administration, according to Section 100 of the Constitution. The Constitution makes it clear when a provincial department cannot fulfill its core mandate, Section 100 intervention must be used. The Premier of the province has admitted that they've lost the battle against this virus. Hospitals in the province have long reached full capacity. Healthcare workers are getting infected, and those who are left to hold the fort are doing so at a great cost to their lives. People are fighting each other for mere oxygen. All the while, the provincial government invests tens of millions of rands on glorified scooters that you personally endorsed. Secondly, you can go back to the drawing board with National Treasury and commit funds to provinces so that they can begin mounting a decent response to the pandemic. Places like the Nasrec facility, which you mentioned, will become white elephants if they are not staffed or well equipped in a way that can save lives. Simply putting in beds is but the beginning of the process. Thirdly, money that is allocated must be accompanied by strong operational plans and strategies per province. It is simply not good enough to wait for the explosion of cases, then it might be already too late. These plans must make provision for additional critical beds, additional staff, testing and tracing capacity. This must be done even if it means setting up a parallel system that bypasses the dead wood in some of these departments. This is not the time to choose political allegiances. This is the time to save lives. Lastly, without adequate contact tracing, sibethwa sibochelelwe. Much fanfare was made about making use of cell phone location services, which will be used in conjunction with the community health worker program. This seems to have been a non-starter. With results taking up to 10 days to be communicated back to people and virtually no contact tracing being done, we are failing. We are only at the beginning of this battle. Testing, tracing, and tracking must be the cornerstone of government strategy. Minister Mkhize, we may not have been able to prevent this pandemic from arriving at our shores, but we can minimize its destruction. We can save lives. These are interventions that you can make today to stop the bleeding. However, you have to have the courage to choose the people of South Africa over what may be politically expedient. You have to make the difficult choices.
On virtual
Thank you very
platform.
much, Honorable Member.
Yes, thank you very much, Chair.
Oh, Gwen, okay. Thank you. Continue, ma'am. Continue,
Thank you very
ma'am.
much, Chairperson. In times of crisis, the real leadership sometimes emerges, Chairperson. This kind of leadership is able to steer nations across troubled waters. It is able to inspire hope. It never leaves the nation unattended, and it's never an impression that it is everyone for themselves when nations have real leadership. The corona pandemic has exposed in such a dramatic and painful manner that this country does not have that kind of leadership at a state level, and that perhaps we never had leadership at all for a very long time. Today, South Africa has over 216,000 known cases of corona, almost 4,000 people have died, and we get at least 10,000 positive cases per day over the past week. And in April, when Italy was at its peak, it had about 129,000 total cases of COVID, and their daily infections were around 6,000 on average. You and the expert minister that we have around you claim we have not even reached the peak of the virus, yet we are averaging 10,000 cases a day. What this means, therefore, is that when the storm you consistently speak about, we may see death and carnage of apocalyptic proportions. South Africa will be a case study of how not to manage a pandemic. Unfortunately, some of us may be death statistics by the time this pandemic is over, if it will ever be over. We do not have the hospital capacity, Minister, to deal with this. We do not have enough trained healthcare workers. We are not testing enough, and our capacity for contact tracing is pathetic and almost non-existent. In the midst of all of this, Honourable Minister, you have reopened, you and your President have reopened everything in the economy using the Champion logic that the virus will only kill a few people. How many people must die for you to be satisfied that this is a serious virus? If one death is not enough, then how many more deaths must happen? Why are we not bothered to say the only people at risk of death are those with comorbidities? You have indicated that people with diabetes, for instance, are at greatest risk. Well, in this country, we've got over 4.5 million people that are living with